Imagine being told you have a disease so silent, so deeply hidden, that by the time you finally notice something is wrong, your body has already been fighting an invisible battle for months. There are no loud alarms, no dramatic warning, no single moment when everything suddenly changes. Instead, the disease quietly grows in the background while life continues as normal. Now imagine that the very first signs were not unbearable pain or a medical emergency. Instead, they were things you explained away without a second thought. A little more fatigue than usual, a sore back after gardening, a loss of appetite that you blamed on getting older. Maybe you even laughed about it, telling yourself that age catches up with everyone eventually. That is exactly what makes pancreatic cancer one of the most dangerous diseases in modern medicine. It rarely announces itself. It disguises itself as ordinary problems that millions of people experience every single day. Because those symptoms seem so harmless, people ignore them until the disease has already progressed beyond its earliest stages. Today, we are not here to frighten you with statistics or survival charts. Fear alone has never saved anyone. Knowledge has. In the next few minutes, you will learn the warning signs that your body may send long before pancreatic cancer reaches its most dangerous stage. More importantly, you will understand why these symptoms happen, what they actually mean, and when they deserve immediate medical attention. Remember this throughout the video. Any one of these symptoms can have many harmless causes, but when several appear together, or when they persist despite your best efforts to explain them away, they deserve to be investigated. Early recognition gives doctors the greatest opportunity to find the disease before it spreads. Let us begin with one of the earliest warning signs, a symptom that quietly appears in your bathroom long before most people realize something is wrong. Imagine waking up one morning and catching your reflection in the mirror. At first, nothing seems unusual, but something feels different. The whites of your eyes seem ever so slightly yellow. Your skin looks dull, almost as though someone has adjusted the brightness of your complexion. You shrug it off. Perhaps it is simply the lighting in the bathroom. Perhaps you did not sleep well. Maybe you are just tired. Then you walk into the bathroom and notice something else. Your urine looks unusually dark. Not the normal shade of yellow you expect, but much darker, resembling iced tea or even cola. Immediately, your mind jumps to the most obvious explanation. I must be dehydrated. So you drink more water throughout the day. By evening, the color appears lighter, and you feel reassured. Problem solved. Or so it seems. The following morning, exactly the same thing happens again. Dark urine. Again, you increase your water intake. Again, it becomes lighter later in the day. This pattern repeats itself for days or even weeks. Most people never mention this to anyone because it seems so ordinary. After all, dehydration is common. Hot weather, exercise, or simply forgetting to drink enough water can all darken urine temporarily. But pancreatic cancer creates an entirely different situation. To understand why, picture your pancreas sitting quietly behind your stomach. Running beside it is a small but incredibly important tube called the bile duct. Think of it as a drainage pipe carrying bile from your liver into your intestines. Bile contains a substance called bilirubin. Under normal circumstances, bilirubin travels through the bile duct into the digestive system, helping your body process waste products and giving stool its normal brown color. However, when a tumor develops in the head of the pancreas, it can slowly squeeze this narrow duct. At first, the blockage is only partial, then it becomes tighter. Eventually, the flow of bile is interrupted altogether. When bilirubin cannot leave through the bile duct, it begins accumulating inside the bloodstream. Your kidneys now have no choice but to remove the excess bilirubin through your urine. That is why the urine suddenly becomes much darker. Many people mistakenly believe drinking extra water fixes the problem. It does not. Water simply dilutes the urine temporarily. The underlying blockage remains exactly where it was. The next morning, the bilirubin builds up again, and the urine darkens once more. That repeating cycle is incredibly important. Persistent, dark urine that returns day after day, despite adequate hydration, deserves medical evaluation. Unfortunately, many individuals spend weeks assuming they are simply dehydrated, while the tumor continues growing silently. As the blockage becomes more severe, another unmistakable sign begins to appear. The bilirubin circulating in your bloodstream starts settling into your body's tissues. Slowly, your skin begins developing a yellow tint. This condition is known as jaundice. For some people, the change is obvious. For others, especially individuals with darker skin tones, the earliest clue appears in the whites of the eyes or even the palms of the hands. Friends or family members may notice it before you do. Someone might casually ask whether you are feeling well because you look different. Many people immediately assume jaundice must mean liver disease. Others blame gallstones. Both conditions can indeed cause jaundice, which is exactly why pancreatic cancer is frequently overlooked during its earliest stages. Doctors often begin investigating the liver or gallbladder first, because those problems are much more common. Meanwhile, the real cause may be quietly pressing against the bile duct just a few centimeters away. There is another symptom connected with jaundice that surprises almost everyone. It is not pain, it is itching. Not the kind of itch caused by dry skin or an insect bite. This itch seems to come from deep beneath the surface. People describe scratching until their skin becomes red, yet the itch never truly disappears. Creams provide little relief. Changing soap does nothing. Even allergy medications often fail to help. Why? Because bilirubin deposited inside the skin irritates tiny nerve endings directly. The irritation continues around the clock until the underlying blockage is treated. Imagine trying to sleep while your entire body feels intensely itchy without any visible rash. Many patients later describe this as one of the most frustrating symptoms they experienced. When dark urine, yellowing skin, yellow eyes, and relentless itching appear together, they tell a remarkably specific medical story. It is a story that should never be ignored. Now let us move to another symptom that causes enormous confusion because millions of older adults experience it every year. Pain. Not severe pain, not the kind that sends you rushing to an emergency room. Instead, it begins as a dull discomfort high in the abdomen. You feel it just beneath your breastbone. Some days it barely bothers you. Other days it lingers for hours. Naturally, you assume it must be heartburn, acid reflux, indigestion, or perhaps something you ate. You take antacids. You avoid spicy foods. You wait. Yet the discomfort refuses to disappear. Gradually, something strange happens. The pain no longer stays in your abdomen. Instead, it begins wrapping around your body toward your back. Now everything becomes even more confusing. Back pain is incredibly common, especially with age. You tell yourself you probably slept in an awkward position. Maybe gardening strained a muscle. Perhaps arthritis is acting up again. You try a heating pad. You rest. You stretch. Sometimes the pain eases slightly. But unlike ordinary back pain, it always comes back. And every time it returns, it follows almost exactly the same pattern. Doctors who specialize in pancreatic diseases often pay close attention to three important characteristics of this pain. First, it frequently becomes worse about 30 to 60 minutes after eating. That timing is not a coincidence. Eating stimulates the pancreas to release digestive enzymes. When a tumor blocks normal function, pressure builds, making the discomfort more noticeable. Second, lying flat often makes the pain significantly worse. Many patients eventually find themselves sleeping propped up with pillows or even in a recliner because that position feels more comfortable, although they cannot explain why. Third, the discomfort seems to travel. It begins in the upper abdomen and radiates straight through toward the middle of the back, creating the sensation of a tight band wrapped around the body. That specific combination deserves careful medical attention, because sometimes what appears to be an ordinary back problem is actually coming from an organ hidden deep inside the abdomen. Weight loss. For years, you may have struggled to lose a few pounds. Then suddenly the scale starts moving in the right direction, without any effort at all. Friends compliment you. Family members ask what diet you are following. You smile and simply say, "You have not been very hungry lately." But inside your body, something very different may be happening. You sit down to eat breakfast. After only a few bites, you already feel full. Not pleasantly satisfied, but uncomfortably full, as though there is simply no more room in your stomach. You push your plate away. At lunch, the same thing happens. Dinner becomes another struggle. You convince yourself that your appetite is naturally declining with age. However, your pancreas sits immediately behind your stomach. As a tumor slowly enlarges, it can begin pressing against the stomach itself. Even a relatively small amount of pressure can reduce how much food your stomach comfortably holds. At exactly the same time, your pancreas may no longer produce enough digestive enzymes. These enzymes are essential because they break food into nutrients your body can actually absorb. Without enough enzymes, digestion slows dramatically. Food remains in your stomach much longer than normal. Your stomach stays full. Your brain receives signals that you no longer need to eat. Slowly, your calorie intake decreases without you consciously trying. Meanwhile, the cancer itself demands enormous amounts of energy. Cancer cells consume nutrients continuously, forcing your healthy tissues to compete for fuel. The result is weight loss that seems almost mysterious. If you have unintentionally lost 10 pounds, 15 pounds, or more without changing your eating habits or exercise routine, your body is sending an important warning signal. Doctors consider unexplained weight loss greater than 5% of body weight over only a few months to be medically significant. It should never simply be dismissed as aging. Now imagine these symptoms occurring together: dark urine, yellowing eyes, upper abdominal pain, poor appetite, unexpected weight loss. Individually, each symptom could have many explanations. Together, they form a pattern that deserves urgent investigation. There is another warning sign that surprises many people because it often appears far away from the pancreas itself. It begins in the leg. Perhaps your calf suddenly becomes swollen. It feels warm when you touch it. Walking becomes uncomfortable because of a constant aching pressure deep inside the muscle. You assume you strained something while exercising or working in the yard. But sometimes this is not a muscle injury at all. It is a blood clot. Doctors call this a deep vein thrombosis, or DVT. Pancreatic cancer can make the blood unusually prone to clotting by releasing substances that change the body's normal clotting mechanisms. These clots may develop without surgery, without prolonged travel, and without any obvious injury. In fact, for some patients, an unexplained blood clot is the very first clue that cancer exists. Months later, imaging reveals a pancreatic tumor that had been silently growing all along. This is why doctors take unexplained blood clots so seriously. The danger does not stop there. A portion of the clot can suddenly break away. It travels through the bloodstream until it reaches the lungs. This emergency is called a pulmonary embolism. When it happens, symptoms usually appear suddenly. You may experience severe shortness of breath, sharp chest pain that worsens when taking a deep breath, a racing heartbeat, sometimes dizziness or fainting. If these symptoms ever appear unexpectedly, immediate emergency medical care is essential. Do not wait to see whether they improve. Call emergency services immediately. If you have recently experienced an unexplained blood clot, especially without common risk factors, ask your physician whether additional evaluation, including imaging of the abdomen, should be considered. That simple question could lead to an earlier diagnosis. Another symptom, often blamed entirely on aging, is overwhelming fatigue. Everyone feels tired occasionally, but cancer-related fatigue is different. Imagine sleeping for 8 or even 9 hours. You wake expecting to feel refreshed. Instead, your body feels heavier than it did before bedtime. Walking across the room seems exhausting. Simple household chores require frequent breaks. Even carrying on a conversation demands effort. You drink coffee. You rest during the afternoon. You go to bed earlier. Nothing changes. This exhaustion occurs because your body's normal energy balance has been disrupted. Cancer cells consume nutrients aggressively. Inflammation caused by the disease also changes the way your body produces and uses energy. Healthy muscles, organs, and even your brain receive less fuel than they need. No amount of sleep can replace nutrients that are constantly being diverted elsewhere. That is why cancer-related fatigue remains despite adequate rest. It persists day after day, week after week. If extreme fatigue continues without a clear explanation, especially when accompanied by other warning signs, it deserves medical attention. Finally, we need to discuss one of the most overlooked clues your pancreas can provide. It appears in the bathroom. Many people feel uncomfortable talking about changes in their stool. Yet these changes often reveal exactly how well the pancreas is functioning. One of the pancreas's primary jobs is producing enzymes that digest dietary fat. When pancreatic enzymes cannot reach the small intestine because a tumor blocks the pancreatic duct, fat passes through the digestive system largely undigested. This creates several noticeable changes. The stool may become unusually pale or clay-colored. Instead of sinking, it may float because of its high fat content. Its surface may appear greasy or oily. It may leave an oily film in the toilet bowl. The odor often becomes unusually strong and difficult to ignore. These are not random digestive changes. They represent a direct consequence of impaired pancreatic function. Many people also notice nausea after meals, especially meals containing fatty foods. Some experience vomiting. Others simply feel bloated and uncomfortable for hours after eating. Because fat is not being properly absorbed, your body also struggles to absorb essential fat-soluble vitamins. This contributes further to weight loss, weakness, fatigue, and poor overall health. If pale, greasy, floating stools continue for more than a couple of weeks, they should never be ignored. They deserve prompt evaluation by a healthcare professional. Now, let us bring everything together. Throughout this video, we have discussed warning signs that often appear quietly and gradually. Persistent dark urine, yellowing of the skin or eyes, relentless itching, upper abdominal pain that spreads into the back, feeling full after only a few bites, unexplained weight loss, blood clots, extreme fatigue, pale, greasy, floating stools. No single symptom automatically means pancreatic cancer. Most people experiencing one of these signs will ultimately have another explanation. But when several occur together, or when they persist despite treatment, they create a pattern that requires careful medical investigation. The most important step you can take is surprisingly simple. Write every symptom down. Record when it began, how often it occurs, whether it is becoming worse. Bring those notes with you to your appointment. Specific information helps doctors recognize patterns that vague descriptions often miss. Instead of saying, "I just don't feel right," explain exactly what has changed. Tell them your urine has remained dark despite drinking plenty of water. Describe how the pain begins after meals and radiates into your back. Mention your weight loss, your fatigue, or any changes in your digestion. Clear details lead to more focused testing. If your doctor believes additional evaluation is appropriate, imaging studies, such as a CT scan or abdominal ultrasound, may help identify the cause. Remember, asking questions and advocating for your health is not being difficult. It is being informed. Pancreatic cancer remains one of the most challenging diseases because it hides so well during its earliest stages. But hidden does not mean invisible. Your body often whispers before it screams. Those whispers matter. Listening to them, understanding them, and acting on them promptly can make an enormous difference. If today's information helped you better understand these warning signs, consider sharing it with someone you care about. Someone with persistent back pain. Someone who keeps losing weight without trying. Someone who insists they are simply getting older. One conversation could encourage them to seek medical advice sooner. Sometimes, awareness itself becomes the first step toward saving a life.